Hi, everybody. This is Mary Kay Clunies-Ross, Executive Director of the Chronic Disease Coalition. Happy winter solstice. Happy everything wherever you are. It is the end of a really, really exciting year, and we are very glad to have spent this time with you and to be thinking about next year. It's never too early. And as we prepare for legislative sessions to begin, we have thought deeply about our policy priorities, where we're going to put our efforts, and how we're going to help you better to raise your voices. And so we have convened for this one last Chronic University of the year. And if you're traveling and still tuning in, thank you so much for doing that. Really appreciate that. I'm going to have Nathaniel speak about the policy priorities. He works closely with our members and our partner groups to develop that, in addition to our ambassadors who really help set the direction and help us know what is hurting them on the ground. And then Lauren's going to talk about the importance of telling the patient story and how to do that. I mean, we talk about it a lot, but what does it mean and why does it matter? And are there right ways and wrong ways of doing it? These are all completely normal questions, and we're just going to knock them out. This is something we're going to continue to talk about throughout the year, and we want to make it easy for you. So if you've got questions, raise them. If you think other people have questions, some of you are very experienced advocates. So any guidance that you've received from other people, or things that help you do well, go ahead and put those in the chat, and we'll open it up. And then, as always, we'll post some information afterwards, and we'll put some of the stuff in social because we want people to have access to it. This is not just for chronic disease patients; it's for everybody who wants to understand how to be effective in advocacy. But our special focus is always going to be those who are managing chronic diseases. So with that, we hope to make lives better by improving policy across the country. And Nathaniel's gonna talk about how to do that. So thanks, Nathaniel.
Yeah, thank you, Mary Kay. For those that don't know, my name is Nathaniel Brown. I am the Director of Advocacy here at the Chronic Disease Coalition. This is my third year-end Chronic University where we take a look back at the year that's passed and the progress that we've made, but also spend a good chunk of time looking ahead and seeing where we can continue that progress, what issues we can take on, and really come to an agreement on a strategy for making that progress in the new year. So back in this past fall, we, as we do annually, convened our ambassadors, our board, some of our partners to really take a look at our policy priorities. And if you've been engaged with our coalition for any number of years, you know that our policy priority list is long because we cover, our coalition is large and we're a big tent. And so we try and advocate on the issues that are going to be helpful for anyone that is facing or managing a chronic disease. So before we get too far into the 2024 priorities, I wanted to take a look back at 2023. And some of you may have seen this already, but it's a really good recap of the progress that we made in the past year. I want to specifically call out 12 states where we saw priority bills passed. And if you've been an advocate, even if you're not very familiar with advocacy, you probably know that it's usually a multi-year effort to get legislation actually approved and signed by a governor. And so in 12 states, we had priority legislation that we worked hard on. I testified on, we had ambassadors testify on, we had our partners amplifying some of our work on social media. There was a lot of work that went into those bills, but it's also a good reminder. We were active in more than 35 states. So the work is very broad. It's nationwide, and there's various pieces of legislation at various stages of the legislative process. And so we're really proud of the work that was done in 2023, and we're looking forward to 2024. And I just wanted to take this moment to thank our advocates who have helped us in the past year, and really just communicate that we've got a lot of opportunity coming up in 2024. So with that, I wanted to talk a little bit about our policy priorities for next year. There's nothing new here. We are changing the way we articulate our policy priorities, though. In years past, we have adopted, along with our ambassadors and our board and partners, we have adopted a list of policy issues that we know are going to be, that are going to see some movement, that are, where we want to be engaging. And they've all kind of fallen under these buckets of access, affordability, and representation. And this year we've decided to pivot a little bit, and our board adopted these policy values, and with the understanding that we'll still advocate on all the same issues that you care about, things like step therapy, copay accumulators, rare disease advisory councils. But the intent here is by leading with our values, we're able to incorporate additional issues. If an advocate were to come to me from Florida and say, hey, we're dealing with this issue here, and that wasn't technically on our policy priority list, as long as it falls into one of these buckets of access, affordability, or representation, I now have our organization's blessing to pursue that and to put as much resources behind that as we can, and to be a full partner for you as you work to advocate on those issues. So we're really excited about this shift. I also think that the values that are listed here are not specific to patient advocacy groups. I think people across the healthcare spectrum all agree that we can improve access, we can improve affordability, and we can improve representation. And so we're trying to send a signal to folks, that might be on the other side of some of these conversations, legislators that might not always agree with us. We're really willing to come to the table and to work with anyone who wants to improve outcomes for chronic disease patients. In 2024, we have a lot of states and a lot of issues that we're anticipating are going to see some action. And I think with this map, I really just want to communicate that there is an incredible amount of opportunity. It's really exciting. These are just the places we know are going to be introducing legislation that we're going to care about. If your state isn't on here, please don't worry. That's part of the flexibility I was just talking about. If you're in Wyoming or Montana, or if you're in South Carolina, right? Please come to me if you're working on an issue and you want our help. We're here to be your partner. And so we know that there's a lot of issues that are, sort of our bread and butter issues: step therapy reform, copay accumulator bans, Medigap expansion. All of those things we have on our radar. We're in conversations with coalitions that are on the ground, as I'm sure many of you are. But really just excited about the opportunity to engage nationwide next year, and to increase the number of states where we see priority legislation passed. We hit 12 this year. I think we can increase that. I think we can go above and beyond, especially if we can get all the help we can get. So with that, I want to stop sharing the slide deck and start sharing let's see, the Chronic Disease Coalition website, because there's a lot of different tools. There's a lot of different tools on our website that I think are going to be very helpful for advocates of all different abilities and comfort levels. If you don't have the Chronic Disease Coalition website bookmarked, I would recommend doing that. It's really a one-stop shop for people that are looking to engage with their legislator, or are looking to learn about the issues that impact a broad variety of chronic disease patients. So I'm going to start by going through some of our policy issues. And I mentioned some of these, they were on the previous slide, but you can go to this page. It's under the Get Educated tab. And you can see our policy platform, which we'll be updating before the end of the year. You can go to the policy map, which we'll talk about in a sec. But you can go into each of these issues: telehealth, step therapy, copay accumulator programs. You can learn about what those are, how they impact patients, and then download one-pagers that are meant to be distributed to legislators, to fellow patient advocates, to family and friends. Right? They're meant to be very universal. And we always incorporate a patient voice in these documents, because we feel like it's really important to tie these sometimes complex policy issues back into the patient experience, and for legislators and decision makers to really understand why we are putting so much emphasis on some of these issues. And so this is just one example, but protecting and supporting living organ donors. We have a couple of key facts here. We have, why it's important to protect living donors and incentivize organ donation. And then, of course, we have Peter Young and Gil Dong's story included on the one pager. And so it's one page for a reason. It's meant to be very simple. It's meant to be very digestible for people of all comfort levels and people that are at different levels of familiarity with the concept. And we do that for all of our priority issues. So you'll see we've got premium assistance bans, chronic disease task forces, Medigap, healthcare workforce, mental health, PBMs, and the list goes on. And so we will be using these throughout the year as we educate lawmakers, as we educate our partners on the issues that we care about, and we hope you will too. They're meant to be downloaded and shared far and wide. I'm going to take a quick drink. I got a scratchy throat. Okay. The next thing I'd like to bring to everybody's attention, we do have an advocacy toolkit. So now that you've got a better grasp on some of the issues, you can go here and find a lot of tips and tricks on how to advocate online, how to advocate in the public, right, with the news media, and then policy advocacy with legislators, writing letters and speaking during public hearings and things like that. There's a lot of helpful tips and tricks. And then there's also advocating for yourself in the doctor's office. It's really kind of a one-stop shop for everything that you need to know advocacy-wise. And you can download the whole toolkit here. It's fairly comprehensive. I'm not going to go through all of it right now, but I wanted to make sure everyone knew where this was. The next thing I'm going to take you to is the policy map, which I mentioned a little bit ago. This is something we introduced in 2023, and we saw really an overwhelming positive feedback on it. But it's a real-time policy map that shows state by state which issues the Chronic Disease Coalition is focusing on, and it will direct you to the state legislative website where you can find updates on that bill. So right now we've wiped it clean for 2024 or 2023. We're going to start fresh, after the 1st. But as January progresses, as legislators convene, as bills are dropped, you'll start to see these states getting darker and darker with the number of bills that have been introduced and the number of bills that we are working on. And so you'll see if you click on your state, obviously there's nothing in Texas right now, but there will be, right? If you look at Wyoming, you can find those bills, and a lot of the times if there's a state-specific call to action, you can click this button and it's going to take you to our call to action page, which I will go to next, which is under Take Action, Contact Elected Leaders. This is a really innovative and easy way to contact your elected officials. And there's a number of different issues on here that we hope you'll advocate on. Some of them are state specific. A lot of them are federal, just because obviously this website is accessible to everyone, no matter what state they're in. But we do plan to be increasing the number of calls to action in the new year and opportunities for you to engage. So you can go through here and click through to any of these issues that you might care a lot about, you might have experience with. And if you click on it and plug in your address, it will auto-populate your elected officials. It will auto-populate the subject line and some key facts about the bill, why it's important to pass, and why it's important for chronic disease patients specifically in the district. And there's also this place over here where you can add your own story if you have a personal connection to the issue. You don't have to have one, but if you've got a personal connection to the issue, you can say, I am a transplant recipient, or I was discriminated against at work because I donated an organ, right? You can add your personal story here and then also edit anything you need to in here. And then all you need to do is click send message. And then it gets into your legislators' inboxes. Ideally, someone from their office will get back to you and the conversation is started. I think it's a really easy way to get engaged, something you can do in 2 minutes. And we typically like to share these kinds of calls to action in our newsletter. Lauren will talk a little bit about how to get engaged and how to make sure that you're sharing your story with us, but because there's just so many different ways. But contacting your elected leaders via our website is really one of the simplest, easiest ways to get engaged. So if you've got a New Year's resolution to advocate more, I would make sure you're visiting this page frequently. So I will stop sharing and move back over to the slide deck. I wanted to, before we get into telling your story, I wanted to talk through some of the examples of our ambassadors and how they've been telling their story, how you can level up a little bit after those calls to action, right? I think starting with digital advocacy is a fantastic place to start if you're new to these issues. But there's a lot of different avenues that we can help you with, depending on your comfort level, to engage with your legislator. I think number one is going to be to become an ambassador. This is a monthly opportunity to share information, talk about really anything you'd like. I mean, obviously we come with policy updates and requests of legislators in various states, but it's always to your comfort level. And if you are interested in becoming engaged, this is really a fantastic opportunity to join a lot of peers and supporters in sort of a united effort on all of the policy issues that we talk about. There's also different ways to engage. You can request a proclamation of your governor during Chronic Disease Month, which is a fantastic way to raise awareness about the issue. You can provide testimony. We're here to help with all of this, right? If you're interested in providing testimony, we would absolutely love your help in a public hearing. Obviously, your experience and your story is the most impactful thing we can share in terms of advancing legislation. So we can help you with talking points. We can help you draft the testimony. We can point you in the right direction and sometimes even attend with you. Checking in with your legislator, just simply sending a note and saying, hey, I'd like to grab a coffee, or hi, I'd like 5 minutes just to introduce myself. Let them know I'm a resource, right? If they're working on healthcare legislation in the upcoming session, or there's a bill that you like or that you don't like, it is your right and your obligation to connect with your legislator and your elected officials to let them know how that bill would impact you. And we're here to help with, again, talking points. We can even make the introduction with your legislator. We're here to make this as easy as possible. Of course, you can also write op-eds, letters to the editor. I think we're going to also be trying to do some more of this in 2024. But this is an excellent way to get patient story and our perspective on policy issues out to the public, and to make some additional noise. So there's a lot of different opportunities to engage, to be an advocate on these issues. And I just want to reiterate that we're here to help however you need it. I think with that, except for one more plug for the website, it's really all the information is going to be on there. I will pass it over to Lauren, who's going to talk a little bit about how, once you've identified an issue that you're passionate about, or you want to advocate on something in your state or in Congress, you need to be able to communicate your story and to communicate how that policy impacts you on a personal level. And so I'm going to pass it to Lauren to walk you through some best practices on how to do that.
Thanks, Nathaniel. That was a lot of information, a lot of really good information. So I just want to reiterate to everybody joining us live today that if you have questions in real time, feel free to put it in the chat, ask us questions. We want this to be as helpful for you as possible. So don't be shy. So now that you all are excited about telling your story and getting involved, we want to talk you through some best practices of how you can tell your story. So what we're going to do is we're going to take you through a few tips and tricks of how to best tell your story. And then what we're actually going to do is show you guys a little bit of a template that you can use for any place that you want to tell your story that you all can screenshot in real time, or we'll have this recording, something that you can use sort of after the fact. So a really easy tool for you to use that. So first at the top here and talking through how to tell your story is really just making sure that you keep things brief, as brief as possible, right? In today's day and age, we have a little bit of a short attention span at times. And so being able to tell your story in a short, concise way is really going to be the best way to get your message across. And one of the best ways that we do that is that we highlight the most important aspects of our journey and really find a hook into that. So some of those most important aspects of your journey might be, the time that it took you to get your diagnosis. We'll go back, Nathaniel. How how much money you spent, things of that nature, right? But really just those most important things. I think we talk a lot about the chronic journey and how long it might take, and it's probably years and years and years of your life, and in these situations, just not the time to tell the whole story, but really focus in on the important parts. Make sure that you have a single message or an ask, right? This is not the time to go in with 100 different asks or 100 different messages, but really making sure you're there for a single reason that really resonates with somebody. And jargon, right? I think in these instances, it's really easy for us to have really confusing words or terms, right? When we're talking about the medical industry or we're talking about the insurance industry, just try to avoid that as much as possible and use the everyday terms that people are going to know and really easily understand. It's going to help them to better understand your issue and know how to help you. And then I think we've heard the term a lot is tell people what you're going to tell them, and then tell them again, right? Sort of that tact of how to tell a really compelling story. So I think that that's a really good way to go about telling your story, is introducing yourself, saying what you want to talk to somebody about, tell them what you're going to tell them, and then reiterate what you just told them. And then last but not least, make sure that you're practicing with somebody, right? Whether that's your friend or a neighbor, make sure that you have put it in front of somebody so that you know what you're saying is most beneficial and you're getting the right things in front of them. I know that I've practiced in front of people before, and they give very good feedback of things you may not want to say or things that you should include. So make sure you go in front of somebody. It also might help ease your nerves. The second thing that we want to talk about, right, is impact. So this is really important to highlight why you're in the room and what sort of asks that you're coming with. So impact is at its easiest is it's just, how have you been challenged by this issue? So how long did it take you to get your diagnosis, right? Was this something that took years and years and years for you to figure out, or something that took just a very long time? That can be really challenging, and people understand the challenge of that. How much money have you spent? So this could be things like gas to go to a doctor's visit, going back and forth, or maybe how much your medication costs. There's a lot of different costs associated with chronic illness, and very easy for people to understand the impact that money has on people. And the other side of that is family and job impact. So something like this might be saying that I can't have a job because I have to go to all these doctor's appointments, or I can't take care of my family because my medication is too expensive and I have to pay for my medication as opposed to paying for childcare or food or rent. So those are really impactful stories that people want to hear and will help to help you get the ask that you're looking for. And then lastly here on this slide is a very clear ask. How can this person help you? Instead of just telling your story to tell your story, you're telling your story to have somebody help you with something. So is it simply just for them to understand your challenges? Is it to support a bill? Or is it to help connect you to a state agency? So on that last one there is something along the lines of, let's say you're on Medicaid and that's a state agency and they're not doing something that works well for you. Maybe it's they're not responsive, or a certain system is not set up to be beneficial to the patient. Your representative can kind of help you with that. And then last here, in this last tip that we're going to talk about is just sincerity. I think that it's really important for us to remember that legislators are humans too, and that this is their job to listen to you. So go into it with just a good conversation. As Nathaniel said earlier, invite them to coffee, just have a conversation with them, talk to them like a friend. You don't need to be scared of this conversation. They should be a resource for you, and you can be a resource for them. And that's something you can offer to them is, hey, how can I be a resource to you for future needs? Who can I connect you with? Or I have knowledge on this. If you need more, I'm here in the future. And I think that that's really beneficial for them moving forward. So now that we have all of those tips that you're going to use and you're super excited to bring to life, we've created a little bit of a template for you to use. And this is in no means comprehensive of everything that you could say or the exact template that you might want to use, but this is a really good starting guide for everybody in your journey. So it starts off as simple as just introducing yourself, right? Hello, my name is, and I'm here to talk to you about whatever you want to talk to them about. I live with your chronic illness, and I want to share why what I'm here to talk to you about would help me and the more than 133 million Americans living with a chronic disease live a better life. That last sentence is really important because it highlights the fact that this is not just a issue that's important to you or only going to impact you and a few other people. It's going to impact millions and millions of people. So it's a very important issue. Then we're going to ask you to include 3 important facts about your disease or the challenges that you faced. We'll show you some examples of that. And then lastly, round it out with, to improve those challenges, I'm asking that you very clear ask. And if you have questions about my experience or the experience of other chronic patients, I'd be happy to discuss it further. Again, offering to be a resource. So this is something that you could use if you want to fill out online, right? As Nathaniel took you through on how to send a letter, and there's that option for you to add more of your story. Use this template if you want, right? Or something you could actually use as sort of a starting guide to have a conversation with somebody. So this could be used in a lot of different situations. So we've put this together and given you a little bit of a fake example here. So this is just something that we made up of how this might look for you. So we might say, hello, my name is Sally Smith, and I'm here to talk to you about the negative impacts of copay accumulator programs. I live with chronic headaches, and I want to share why stopping copay accumulator programs would help me and the more than 133 million Americans living with a chronic disease live a better life. Without my medicine, so this, now we're going into impacts, right? Some 3 different impacts. Without this medicine, my chronic headaches make it impossible to get out of bed. That means I can't take care of my children or hold a steady job, and completing small everyday tasks like brushing my teeth or making a meal very difficult, right? Again, very easy to understand. Everybody understands that those should be easy tasks to complete and something that everybody has to do to live. The medication I need to stop my headaches costs about $1,000 a month, which often means I have to choose between getting my medication or paying rent or feeding my family. Again, highlighting that impact of why you're there for that ask and how severe this might be for you. And then bringing it all together to help improve these challenges, I'm asking you stop copay accumulator programs to ensure I can pay for my medications. If you have questions, I'm here for you. So again, some important parts of this is that we have one simple ask that we want to stop copay accumulator programs. We talk about what we're going to ask them about at the beginning. We also say, we reiterate it again at the end, and then we really easily share the impact of this with 3 easy to understand points, no jargon, no deep medical terms. And this should be really easy. And as you saw, it took me about a minute to take you through, so it should be quick for you as well. So again, this is something that you can screenshot. We'll have this recorded. We always have it on our website and our social channels that you can take this and use with your digital advocacy or in-person advocacy or meetings, however you want to do that. If you need help with this, we're always here for you. You can email myself or Nathaniel. And now I'll pass it over to Mary Kay to close this out.
Hi, everybody. Thank you guys so much. That was a ton of information in a really short amount of time. So I want to repeat some of it. As you'll repeat your messages when you talk to legislators, lawmakers, their staff, other groups, There is nothing more important than the patient story. We talk to a lot of legislators, and they consistently tell us that it's understanding a problem from the point of view of a patient that helps them understand why a policy solution is needed. And we hear this over and over again. We hear it from Republicans, we hear it from Democrats, where they maybe meet somebody in the community and they're inspired to make a change, or they just that perspective helps them understand where and how the healthcare system is broken. And it's so important that they hear that, because otherwise they just simply don't get that perspective, and their view of this situation is limited. And that's why, we've got great tips and tricks for you on telling your story and connecting it to policy. But also, don't be afraid if you're uncomfortable talking about policy. You can talk about the problem. You can even narrow things down to the hardest thing about being a chronic disease patient is I don't know what my costs are going to be month to month. This is an unpredictable landscape for me. I don't know what my health is going to do. I can't always see a specialist. So there's a lot of aspects of this that we can help. Lawmakers are people like us too. It's really important that even though they are making decisions about policy and law that are going to last forever, they're also not always experts in those things. But what they are people who are here to represent us. And if we tell our story to them, then they carry that story forward. And one of the reasons, frankly, why stories are so important is we're wired to remember them better. And so we can, as policy experts, and we work with lobbyists from the other organizations and other kinds of experts who can say, here's the data, here's the facts and the numbers that show how and why these things happen. We're just wired to remember more a patient who says, I was prescribed medication and I can't afford it. Or I was prescribed medication, my insurance company said I couldn't have it without trying something worse first, and I'm getting sicker every day. So these are the kinds of things that help lawmakers and that really do drive change. And when we change law and policy, we change the playing field for everybody. And we're here to help do that. And we do that in a lot of different ways. We do that by interacting directly with lawmakers. We do it through the educational materials that Nathaniel showed, by creating a platform so that you can easily communicate the basics of the information to lawmakers, and being a resource. So if you do happen to have coffee with a legislator, or you're out on, at a county event, or something where you run into somebody who's an elected official, you can say, I'm a chronic disease patient. These are pain points for me. And the Chronic Disease Coalition is an organization that understands how the laws affect those things for me. So you don't have to carry a ton of knowledge. We can do that work for you, and we can find people who are even more expert than we are in those things. But you can do what no one else can do uniquely, which is tell the patient story. So we are really excited to look ahead, look at 2024, make plans, and we're going to be drawing the connections between the patient story and the impact that we can have on law and policy even closer this year. So if you have questions about some of these things, or know that you've had problems and you're not sure what that law or policy solution might be, raise it with us and let us know, and we'll point you in a direction. Even if it's not us, we have a lot of really wonderful expert partners in this space as well. And we're not competitors, we're supporters of each other. So if we think that the Arthritis Association might be a better source of information for you, or some other organization is, then we will happily point you in that direction. The goal is to be effective and to help each other. So with that, I don't see any questions in the chat. We'll just continue to educate and to activate, and we wish you the best of the new year. Thanks, everybody.